Everybody, I am Nofal. Welcome to my channel. Today we are going to discuss regarding atherosclerosis, coronary artery disease, angina, myocardial infarction and heart failure. So before moving to the topic, I would like to tell to you what we are discussing, that much only they will ask for Nclex RN exam, HAAD, Prometric, Pearson view, MOH, DHA, whatever it may be. And what they are asking, that much only we will discuss. So we can see regarding atherosclerosis. So what is meant by atherosclerosis? So just think, this is a artery. So in the artery we know oxygenated blood will be there, right? So in any artery, a fat deposition is there. A fat deposition is there in any artery. We will call it as atherosclerosis. Or plaque formation. Okay, any artery, fat deposition is there in any artery, you can call it as atherosclerosis or plaque formation. Okay, that is atherosclerosis, fat deposition in the artery. Now every artery, the fat deposition is there, you can call it as atherosclerosis, but most commonly affected artery is coronary artery. Most commonly atherosclerosis affecting artery is coronary artery. Coronary artery is the artery of the heart. If atherosclerosis is occurring in the coronary artery, you can call it as coronary artery disease. Okay, you can call it as, if it is occurring to the heart, you can call it as coronary artery disease. Okay, so any artery fat deposition is there, atherosclerosis. In the coronary artery, the fat deposition or atherosclerosis in the coronary artery, you can call it as coronary artery disease. Clear? Now in the beginning, the fat deposition will be very minute. So the patient is not having any problem related to the condition. But gradually the size of this deposition will increase. Okay, slowly the size of the fat deposition or the atherosclerosis will increase. So here what will happen? The blood flow will decrease to the heart. Just imagine this is heart, the blood flow will decrease to the heart. Now the patient will complain regarding chest pain, that is called angina. Clear? That is called angina. That is angina. Okay, due to coronary artery disease, that is the atherosclerosis in the coronary artery, blood flow is decreased. Now the patient is complaining regarding chest pain, that is angina. Okay, now again the deposition, the fat deposition is increasing, the blood flow is again decreased. Blood flow is again decreased. Now the heart tissue death is occurred. The tissues of the heart death is occurred. Heart tissue death is occurred. And chest pain is there, heart tissue death is also occurred due to decreased blood flow to the heart. That condition is myocardial infarction. We are calling it as myocardial infarction or heart attack, that is MI. Clear? That is myocardial infarction or MI. Now the patient is not recovered from, or the patient is not regained from myocardial infarction from MI. What will happen? Inability or the ability of the heart to pump the blood will decrease. Ability of the heart to pump the blood will decrease. This condition is called heart failure. Okay, this condition is called heart failure. Also known as, heart failure is also known as congestive heart failure. Congestive heart failure. So if you are seeing congestive heart failure or heart failure, it is same only. So from the beginning, in any artery, fat deposition is there, you can call it as atherosclerosis. If atherosclerosis is occurring in the coronary artery, we can call it as coronary artery disease. Due to coronary artery disease, the blood flow to the heart will decrease. That time the patient will get the chest pain. You can call it as angina. Due to the coronary artery disease, the blood flow will again decrease, and this time the heart tissue death will occur. That time you can call it as myocardial infarction or MI. Now the patient is not regained from myocardial infarction. The ability of the heart to pump the blood, that will decrease. That condition is heart failure or congestive heart failure. That is inability of the heart to pump adequate amount of blood to meet the metabolic need. Inability of the heart to pump adequate amount of blood to meet the metabolic need of the body. That is heart failure or congestive heart failure. Clear? But for your exam, very important is risk factor. Risk factor of coronary artery disease. We can see one by one. Risk factor of heart failure mainly classified into risk factor. Okay. Mainly classified into modifiable and non-modifiable. And non-modifiable. Okay. So the main risk factor of coronary artery disease is modifiable and non-modifiable. Very important for your exam. Repeatedly it is asking for HAAD, DHA, Prometric exams. Risk factor. Okay. So the risk factor is modifiable, means you can modify or you can change or you can stop. For example, smoking. Smoking is a risk factor of coronary artery disease, but it is modifiable. Next one is alcoholism. Next one is obesity. Obesity also with diet and with physical activity, with exercise, you can modify that risk factor. And next one is hypertension. And next one is diabetic mellitus. Very, very important. Keep it in mind. Most of the students, if they are seeing the option, they will give diabetic mellitus or hypertension in non-modifiable. The question will be, among this, which one is the modifiable or non-modifiable risk factor of coronary artery disease? Keep it in mind. Diabetic mellitus and hypertension is a modifiable risk factor, because you will think once the patient is hypertension is positive, that means lifelong he is a hypertensive patient, or diabetic mellitus, lifelong diabetic mellitus. No, as per your exam you have to keep it in mind, it is a modifiable risk factor, because it is a lifestyle disease. With diet, with exercise and with medicine, you can control hypertension and diabetic mellitus. So it will come under the option modifiable risk factor. So what is the non-modifiable? You can't modify, you can't change. What is the non-modifiable risk factor? That is age. Your age is a non-modifiable risk factor, because now your age is 50, you can't change your age to 25, right? So age is a non-modifiable risk factor. And sex, non-modifiable. Family history, you can't change. And race, if you are a African or if you are an American or if you are a Asian, whatever it may be, you can't change your race also. So non-modifiable age, sex, family history and race, all the remaining thing like smoking, alcoholism, obesity, again I am repeating, hypertension, diabetic mellitus and increased cholesterol level, whatever it may be the option, it is modifiable. You can modify, you can change. Clear? So the risk factor of coronary artery disease we discussed, but for myocardial infarction also, due to coronary artery disease, MI is occurring, right? So the risk factor for MI is same, as well as the risk factor for the heart failure also same risk factor. And one more thing I want to tell to you, atherosclerosis in the cerebral artery, fat deposition in the cerebral artery is stroke, right? So for stroke also risk factor is same. So here coronary artery disease, risk factor is same, myocardial infarction, risk factor is same, heart failure, risk factor is same. For stroke also same risk factor you can use, but for exam they are asking like this, among this which one is the modifiable, which one is the non-modifiable. Clear? Now we can see regarding the difference between angina and myocardial infarction, that is MI, we can see. So here a patient is coming to the hospital with chest pain. Okay. So how to identify it is angina or it is a heart attack, that is myocardial infarction. Okay, first thing you have to keep it in mind, if it is angina, the pain will reduce or the pain will decrease or the patient will get relief from pain during rest. During rest, the pain will get relief. Okay, during rest, the pain will decrease, but here the pain will not decrease during rest also. If it is myocardial infarction, the pain will not decrease during rest also. If the patient is taking the rest also, pain will be there in myocardial infarction. Next, in angina, the pain will decrease by giving nitroglycerin. That is NTG. Okay, nitroglycerin. If you are giving nitroglycerin to the patient sublingually, we are giving, that is below the tongue, we are giving nitroglycerin. The patient will get relief from the pain if you are giving nitroglycerin in angina. But in MI, the patient will not get relief from the pain if you give nitroglycerin also. So how you have to give the nitroglycerin? For exam, the question will come. So you have to keep it in mind. 5 mg, you have to give 5 mg nitroglycerin sublingually, below the tongue you have to give to the patient. Wait for 5 minutes. Now you have to closely monitor the vital signs and ask to the patient regarding the pain, how you are feeling now. If the patient is complaining regarding the pain, again give another dose of nitroglycerin 5 mg. Second dose of 5 mg nitroglycerin you have to give. Again wait for 5 minutes, closely monitor the vital signs and ask regarding the pain. If the patient is complaining regarding pain, again give the third dose of nitroglycerin 5 mg. 5 mg 3 times you have to give and wait for 5 minutes, closely monitor the vital signs, ask regarding the pain. If it is angina, the patient will tell, now I am not having much pain. Patient will get relief from the pain. But it is MI, myocardial infarction, patient will tell, still I am having pain. So the drug of choice is very important, that is morphine sulfate. Morphine sulfate is the drug of choice for myocardial infarction. Keep it in mind. Okay, if it is MI is diagnosed, so no need to give nitroglycerin, directly you can go to morphine sulfate. It is a opioid analgesic, but it is not confirmed whether it is angina or MI. You can give nitroglycerin, wait for 5 minutes, give the second dose, wait for 5 minutes, give the third dose, wait for 5 minutes. Patient is not getting relief from the pain, you can give morphine sulfate. Clear? Now regarding the vomiting, in angina, the vomiting chance is very less. Vomiting is very less. But here in MI, the chance of vomiting is very high. Vomiting chance is very high in myocardial infarction. Vomiting chance is very high in myocardial infarction. And regarding the ECG, you can see ST segment depression in angina. ST segment depression in angina. ST segment depression. Okay. In ECG we can see PQRST wave. Here ST segment depression we can see, but in MI ST segment elevation. ST segment elevation you can see. Okay. ST segment elevation you can see. And regarding the cardiac enzymes, if you are checking the cardiac enzymes, here it will be cardiac enzymes will be normal, but in MI cardiac enzymes will be elevated. Okay, it will be normal cardiac enzymes. If you are checking, it will be normal in angina, but in MI it is elevated. This is the difference between MI and angina. How to identify it is very easy. The drug of choice is morphine sulfate. If you are diagnosed with myocardial infarction, no need to give nitroglycerin, directly you can give morphine sulfate. Clear? Now, one more important question regarding the MI, that is, what is the antidote of morphine sulfate? Very important question for you. Antidote of morphine sulfate is naloxone. Naloxone is the antidote of morphine sulfate. Morphine sulfate toxicity is there. The antidote, the question is morphine sulfate toxicity. What drug you are going to give? The answer is naloxone. Keep it in mind. Clear? Now, regarding the heart failure, some questions you have to expect regarding the heart failure. So here in the heart failure, mainly two type of heart failure you can see, that is right side heart failure is there as well as left side heart failure is there. Okay, we know that for heart, right side is there, left side is there. For heart failure also, right side heart failure is there as well as left side heart failure is there. Okay, so regarding the heart, just imagine this is heart. Okay, this is right atrium, right ventricle, and this is left atrium, and this is left ventricle. Okay, so if it is a right side heart failure, in the right side heart failure, what will happen? Here, inability of the right ventricle to pump the blood. The right ventricle is not pumping in right side heart failure. Okay, I am discussing regarding right side heart failure. Here, the right ventricle is not pumping sufficient amount of blood, or the right ventricle is not pumping blood properly. Right ventricle is not pumping blood properly. So what will happen? The right ventricle is not pumping blood properly. The blood will be accumulated in the right ventricle. We know in the right atrium, inferior vena cava is there and superior vena cava is there. From the lower part of the body, the inferior vena cava is bringing deoxygenated blood to the right atrium. From the upper part of the body, superior vena cava is bringing blood to the right atrium. So here right ventricle is not pumping blood. Blood is accumulated in the right ventricle, and what will happen due to the accumulation? The blood will be accumulated in the right atrium also. Okay, so heart is not receiving the blood in the superior vena cava as well as in the inferior vena cava also. Blood will be accumulated. Everywhere, in every vein in the body, accumulation of the blood and vein will be distended. Distension of the vein you can see. Mainly jugular vein, it is a superficial vein in this part. Okay, so here jugular vein distension you can see in right side heart failure. Jugular vein distension. Okay, as well as you can see most of the symptoms will be edema related symptoms. Most of the symptoms will be edema related because blood is accumulated in the vein, every part of the body blood is accumulated. You can see pedal edema, that is edema in the foot or foot edema, and in the liver also blood is accumulated, heart is not receiving. Hepatomegaly you can see, spleen is not blood is there in the spleen also, so splenomegaly will be there, ascites will be there, increase CVP, central venous pressure will increase. Everywhere the blood is accumulated, so most of the symptoms will be related to edema and vein distension. If it is a right side heart failure, for your exam they will give the symptom and they will ask which side heart failure it is. So you have to identify that edema related symptoms. If you are saying, that is right side, always keep it in mind, right side edema related symptoms, vein distension, splenomegaly, hepatomegaly, that is a right side failure. Okay, now regarding the left side heart failure. So in the left side heart failure, we know in the left side of the heart oxygenated blood is there, right? So here same only like the right ventricle, in the left side heart failure, left ventricle is not pumping the blood properly. What will happen? Blood will accumulate in the left ventricle. Due to this accumulation, blood will be accumulate in the left atrium, and to the left atrium, who is giving the oxygenated blood? Pulmonary vein. Pulmonary vein also the blood will be accumulated. Here it is connected to the lungs. Now in the lungs also blood accumulation problem will come. So related to the lungs, most of the symptoms will be respiratory symptoms. If it is a left side heart failure, most of the symptoms will be respiratory symptoms like dyspnea, hypoxia, tachypnea, crackle sound. Most of the symptoms will be respiratory related symptoms. It is very important, they will give the symptom. If you are seeing respiratory related symptom, you have to give the option, that is left. Always keep it in mind, left heart side failure, lungs, L is lung, L left side failure, the symptom will be related to the lungs, that is respiratory related symptom. Right side edema or the vein distension related symptoms, you have to keep it in mind. And the drug of choice is digoxin. The drug of choice is digoxin. That is also a important question for you. This is the drug of choice, and the antidote for digoxin is digibint. Repeatedly this question is also asking, digibint is the antidote of digoxin. Digoxin is a cardiac glycoside. Okay, it is a glycoside, that means it will increase the cardiac output. It will increase the cardiac output, and the antidote is digibint. That's all regarding atherosclerosis, coronary artery disease, angina, myocardial infarction and heart failure. And risk factor is very important, antidote of morphine sulfate is very important, and regarding the nitroglycerin it is very important. One more question you have to expect in any chest pain cases. For example, a question they will ask, a patient is hospitalized in the emergency department with chest pain. What is the first priority? That will be the question. What is the first priority? The options will be provide oxygen, provide semi-fowler position, provide morphine sulfate, provide nitroglycerin. Only the question is, patient is hospitalized with chest pain. So you have to take the option nitroglycerin. You will think we have to give oxygen or we have to give Fowler's position. Okay, but the option for the chest pain first priority is nitroglycerin, NTG. So you have to go with that option. That's all regarding atherosclerosis and MI, CAD, angina and heart failure. We will meet soon with another video. Till that time, thank you and goodbye.